Hello and welcome. Thank you for joining our informational webinar as we hear from Dr. Carl Erickson. Dr. Erickson will be sharing some exciting changes happening to his practice. So welcome, Dr. Erickson. Let's get started by sharing what changes that you've seen in healthcare.
Well, as most people know, the health insurance premiums have gone up, co-pays have gone up. There's a lot of restrictions on getting care done by. We have to do a lot of prior authorizations and take a lot of time to do that. So our paperwork and the time we spend getting things done is much more. And costs have approximately doubled, even more than that since I started practice. I've been in practice almost 40 years now. Hospital costs continue to rise, and the restrictions on hospitalizations are more severe. You have to be in really bad shape to get in the hospital, and even when you do get in there, there's a lot more co-pays and so forth, extra pay, things you have to pay. And there's increased demand to see more patients, and we have to spend more time doing that. And I actually come in the office probably 3 or 4 hours early to do the paperwork and get everything caught up. So it's there's a lot of patient and provider distraction. And a lot of my colleagues who are my age have left practice because they didn't want to put up with the stuff that was being demands being put on them. So that's where we're at right now with changes in healthcare. We just need to have a kind of a reset of some of the things. And I think they generally thought that they were making things better. From my perspective, I don't think it's made it much better. It's just made it more cumbersome for us to practice. So.
Okay. So share a little bit more about what we're here to talk about.
Well, we're talking about a new model of healthcare, and one of the things that always kind of bothered me is that you weren't really in the management of healthcare. We've been in the management of disease management. So healthcare, in my opinion, starts with good nutrition and exercise and more healthy lifestyles, which takes a lot of counseling, a lot of time to accomplish. And we don't really have that luxury of time because we have to, meet our overhead for the office, and so we have to see patients on a timely manner. And most of my colleagues that are working for the big institutions are limited to 10 to 15 minutes per patient and 1 or 2 complaints per clinic visit. And I think that's a problem because, I don't really do that myself. I try to spend as much time as I can to address all the issues, and that's getting more and more difficult to do because it takes more time, and then of course it's almost a volume business anymore. You have to see more patients to make enough overhead to cover your expenses, and it's not a good situation for anybody. So I'd like to spend more time on disease prevention, nutrition, lifestyle changes that would prevent diseases from happening in the first place. Ultimate objective is to provide a higher level of care and service focusing on long-term improvement and achieving optimal health. And that's what I'd really like to do.
Yeah, great. And I know you've kind of shared that term, personalized healthcare membership medicine. Just share a little bit more about what that means for those who might be watching this and they've never heard that term.
Well, it's a membership medicine practice where we actually can spend more time. I can connect by video conference over the internet with patients and do some counseling over the web, or if they have a problem, they can get in touch with me with a cell phone. They'll have my email address, my cell phone, and then if they need to speak to me face to face, we can do it over the web, or we can get them in for a patient visit much more rapidly. Trying to promote more health habits and trying to address things that will correct the problems before they actually get more severe and require more medications and hospitalization and so forth. So,
yeah,
it's an advanced level of care, really. So
yeah. And then share, I know you've already mentioned this, but again, these are considered the three elements
Uh-huh.
of personalized medicine.
Yeah. Well, I have, I think, fairly good relationship with my patients. I try to learn as much as I can about their family and their lifestyle and what's happening to cause some of the problems they have. And I like that. That's one thing I like about primary care medicine is being able to form a bond with my patients. And then this does take time, and you have to spend a little bit more time with patients to get down to some of the issues that are causing healthcare problems. And so it it'll be easier under this new model to spend more time and do more in-depth evaluation of what's needed. And then the communication aspect is, being able to access communication a lot more rapidly with me. And if you need help for an appointment, we'll get you in a lot quicker. So,
Yes, great. Well, this is really, I want you to spend some time talking about this. I know you've mentioned, some of these as you've already talked about some of these points, but talk more specifically about what is going to be part of your membership.
okay, well, we're going to do a more extensive, in-depth physical, which will take a couple hours to do. Will include some body comp analysis. We can figure out your muscle volume, fat volume, metabolic rate. Be easier to get to design a diet that would work to help you maintain your ideal body weight. We can get you into visits immediately as if you need them. And it's more of a detailed evaluation of prevention. So we go through a lot of history and try and get more information about some of the things that may be causing some issues in your life. You know, the executive physical will have some tests that aren't normally included or covered by insurance, and this executive physical is not something that we bill insurance for. It's outside of that, and so we're able to spend more time and get to the bottom of some issues. I can also, which I have done in the past for patients, trying to get them into specialists quicker and maybe have some relationships with specialists where we can maybe expedite those specialist visits and get those done faster. And then if people have a lot of, or patients have a lot of issues, and many patients have quite a few medical issues, and we can try and coordinate those a little bit better, spend more time trying to figure out the best treatment algorithm and so forth for the problem. And it's, I think it's going to be a better way of taking care of patients, I think. So.
Great. Awesome. So this question comes up a lot from patients. So tell us a little bit more about how will this membership practice work with my insurance?
Well, you still have to have insurance because this is an up and over and above your insurance plan. It's for what your insurance does not cover. It gives you a lot more access to me. It allows you to have visits that you can get on an immediate basis. We can work you into the practice. I actually am going to keep my practice kind of running with a nurse practitioner who will see the routine patients that I'm trying to keep it open for my son who's going to come and take over the practice. And so we'll have a nurse practitioner here seeing patients that opt not to see me. And that's because I'll spend more time on these patients that are in the new practice model. It does not, so this is an additional fee above your insurance of $150 a month, and there is some discount if there's more than one person involved.
Mm-hmm.
So, it's a way of keeping my number of patients I take care of actively on a lower level, so I can spend much more time and get more detail about the health problems.
Awesome. Okay. So let me kind of take it from here as far as the pricing, because I know many folks that are watching this recording are going to be excited, wanting to learn more, and really what is the cost. So to go over that, again, Dr. Erickson has mentioned this is an annual fee. It is above and beyond insurance. The fee per person is $1,800. We do offer discounts for couples, which would make it $1,650 per person. We do, though, have annual payment plans as well as quarterly payment plans and semi-annual. So we do have ways for people to break up the payments, which actually a lot of people are jumping on board with. So this is something that we are actively enrolling in patients in today. Dr. Erickson is, just as you mentioned, is really wanting to expand what he is working with each patient, and this is really going to allow him to do it. So definitely encourage everyone to sign up today. It's very easy. We're actually making it so easy that we have it listed here on the slide, and we will provide information as well. But you would just go online, yourcypress.com/Dr. Erickson, and that is going to take you to his dedicated page, where in the upper right-hand corner, you'll be able to click on Join Now and fill out all of the information that we need to get you set up under Dr. Erickson. If you do have any questions at all, please call Vicki Hammock. That is his dedicated patient liaison. She can be reached at 503-233-5273. And again, you can call her, ask her any questions. We're also able to enroll you by phone if that's something that's easier for you to do. We're happy to do that as well. But Dr. Erickson will have a limited number of patients as part of this new membership style practice. So it's really important for you to act quickly and get signed up. And definitely, we'd love to hear from you if you do have any questions. So Dr. Erickson, anything else you want to add?
No, I think I pretty much covered it. So much as I
Great.
right now.
Awesome. Well, thank you so much for your time, your valuable time in sharing, really your reasons for why you wanted to move to this membership style practice, just to really enhance the patient care that you've been providing to folks for 40 years. That's awesome. Great accomplishments. So
Yeah.
thank you, everyone. Thank you, Dr. Erickson. And thank you for everyone who's taken the time to actually watch this video today.